So, good morning everyone. Today I'm going to explain about pelvic inflammatory disease, also known as PID. So, let's move on. So, this pelvic inflammatory disease is an inflammatory condition of the female pelvic organ, and it begins with the infection or inflammations of the cervix, and it can spread upwards, and it involves different reproductive organs. So, it mainly affects the uterus, fallopian tubes, ovaries, and pelvic peritoneum. So, inflammation of the uterus is there, it is called as endometritis, and inflammations of the fallopian tube is called as salpingitis, and inflammations of the ovaries is called as oophorytis. So now let's see what are the etiology or causes. So sometimes the causes can be idiopathic, which means the exact cause is unknown. Usually what happens is the organism is there no that enters through the vagina and ascends upwards through the cervical canal, and PID can also occur following the childbirth also, like that organism that can happen after the procedures, like after childbirth, after abortions, after surgical procedures, or IUD insertion, especially when the infection is present, that time it can. So now coming to the risk factors of PID. So PID is more commonly seen among menstruating teenagers. Having multiple sexual partners also increases the risk, and other risk factors includes absence of the contraceptive pill use, then a previous history of acute PID, then IUD users also, and even women living in the area where sexual transmitted infections are highly prevalent are also at increased risk. So now let us understand pathophysiology. So due to the etiological factors. So due to the etiological factors, like the main organisms or causes will be there, no, they will enter the lower genital tract. They will enter means from the lower genital tract it will goes upwards. Okay, so from there what will happen, there will be the ascent through the cervix. From the cervix it will go, and then it will cause the inflammations of the cervix. Then cervix inflammation it will cause, then this infection will be there, no, then it will spread upwards, means it will move upwards, then it will cause endometritis, inflammations of the uterus, inflammations of the ovaries, there is oophorytis, like this it will be causing. So after like every inflammation it will be causing, after like the organisms, like simple words I will say, that the infection it will be there, no, it generally it will spread from the lower genital tract and it will move upwards, then inflammations of the cervix it will take place, inflammations of the ovary, inflammations of the uterus, and that will lead to PID, that is pelvic inflammatory conditions. So this is the pathophysiology of this, that is pelvic inflammatory disease. So next we'll move on to the next, that is clinical manifestations of the pelvic inflammatory disease, then diagnosis of the pelvic inflammatory disease, and then complications will move on. So this pelvic inflammatory disease, no, in clinical manifestation we'll see like pain will be there, then tenderness will be there, then abnormal vaginal discharge, and even that foul smelling of the vaginal discharge that will be there, then fever, chills, nausea, vomiting will be there, burning sensations, like burning sensations when you will go to urinate, burning sensation will be present, irregular periods will be there. Then diagnosis how we can do of this pelvic inflammatory diseases, like pregnancy test we can do to test for the pregnancy, then high vaginal cervical swab can be taken for checking of the presence of the microorganisms and all, then urine analysis can be done. For that, midstream specimens of the urine should be collected. Then ultrasonography can be done. Then couldocentesis is done, and laparoscopy is done if it is indicated that time only. So this pelvic inflammatory disease, no complications will see, like it can leads to abscess formations also. Then these fallopian tubes are there, no, it can get obstructed also. Then chronic pain will be present, then uterine prolapse, like collapse of the uterus can also be there, then ectopic pregnancy can also be there, like abnormal implantations of the this baby embryo other than the uterus, that is called as ectopic pregnancy. So that also can be there. So next we'll see what are the treatments of PID. In that, first is general management. In that, we can do is like, first we have to assess the severity. Like PID patient will be there, so we have to check for the severity of the illness of that patient. Then in severe cases, like hospitalizations is like recommended only. Then bed rest should be there, adequate rest should be given, then proper fluid intake, balanced diet, then advice like not to do like sexual intercourse till the treatment is completed, that should be also given. Health education and all about the bed rest, importance of the balanced diet and all should be given. So next is antimicrobial therapy. So mostly in this case like the organisms are involved, so broad spectrum antibiotics is given. So examples you can see here. The next is additional management. In this, like if pain, for that analgesics, and if the fever is there, antibiotics can be given. Then antiemetics for nausea, treating the nausea and vomiting, for that antiemetics drugs can be given. And then preventing the reinfections, like if the partner is having any disease, then we have to treat it so that the infection doesn't appears again and again. Then proper antibiotic course, otherwise tablets should be taken properly regularly on the time. In surgical this management, we can see like if the abscess is there, that abscess drainage also can be done. And in case of this for checking in on this, laparoscopic interventions are also there in severe cases, or if PID occurs recurrent, like again and again it occurs, then more procedures can be done. So preventions of the PID. So how we can prevent pelvic inflammatory disease? So first one is safe sex partner. So we have to encourage mutual monogamy and use of the condoms to reduce the risk of the sexual transmitted infection. So proper like safe sex practices should be done. Then contraceptive usage, regular and correct use should be done of it. Then even like safe IUD practices, in that like when the person or when like IUD insertions is done, it should be done aseptic, like aseptic technique should be used, sterilized equipments and all, everything should be used, so that the infection or microorganisms doesn't enters the body from the lower area and all. So early treatment of STDI, so sexual transmitted disease, if or infections are there, then their early treatment should be done. And even health education should be given, like education about the reproductive health, then menstrual hygiene, then early symptoms of PID and various other diseases, not only PID only. Then regular health checkups, so regularly we have to do health checkups like gynecological examinations, so that the early detection, like if early detection is done and treatment is given, so like severity can be reduced, right? So this should be done. Thanks for watching. Like, share and subscribe.